We were established in the year 2009. The primary objective of the Malaysia Healthcare Travel Council is to position Malaysia as a preferred destination for Malaysia healthcare. And we would like to provide the opportunity of high quality health treatment and healthcare to the wider community throughout the world. So this is very important for us in terms of telling the world that Malaysia is the right place to be. Malaysia can provide an affordable treatment and healthcare for patients, and we also would like them to know that Malaysia is the place for them to come and have their treatment almost immediately without waiting for a long time to seek their treatment in Malaysia. Right, so MHTC is very unique in terms of our establishment. I'm very happy that the Ministry of Health and even the government as a whole has confidence in this industry and has identified that healthcare travel to be one of the economic contributor to the wider economy. And this is where we were established, and then for us to drive this new revenue stream to develop further the Malaysia economy. On that note, I can safely say an organization like Malaysia Healthcare Travel Council is very unique throughout the world. Not many countries has an organization such as this, and we serve two main purposes. Number one, we develop a very seamless ecosystem within Malaysia to ensure that our patients, when they arrive from abroad, they can have a seamless journey, they can have a smooth journey throughout their treatment process when they are here in our country. So to get this ecosystem together, we need to work with various stakeholders. This is where MHTC is very strong in bringing in public and private partnerships. So we work with immigration department, we work with private hospital, which is our key stakeholders. We work with tourism agency, travel agency, airline and hotels, and so on. So all of these players will become the ecosystem that can provide a seamless experience for our patients coming from abroad. So that's the first part of our core function. Secondly, when we have all this already put in place, we go out and advocate these services abroad. I'm not so much of looking forward in terms of making a revenue per se in terms of inviting patients here, but what MHTC wants to do is that to provide the opportunity for people. Don't miss this opportunity. Malaysia is a destination of high quality services. Malaysia is a destination for affordable medical treatment destination, and Malaysia is also a destination for I would say immediate treatment that can be sought of for international patients. So it is more of an opportunity that we want to provide to the global community when they come to Malaysia. So this is basically the two core functions of the Malaysia Healthcare Travel Council. Well, Alhamdulillah, we have seen tremendous growth in terms of the number of patients coming into Malaysia and the revenue that we have generated from this particular sector. We are very happy through the diligent work with among my staff here at MHTC, together with strong partnership with the member hospital that we have. All are renowned. We have charted a very, I would say, substantive growth since the year 2011. I can safely say that from 2011 to 2019, the growth rate in terms of revenue from the medical healthcare travel have increased to more than 90%. And in our best year, which is pre-pandemic, in 2019, we have generated revenue from this particular sector reaching up to Ringgit Malaysia 1.7 billion. This is quite significant, especially when we consider these are only hospital bills and not inclusive of spillover spending, which include hotel, airlines, food and beverages, and so on and so forth. So I'm very happy to see, because this shows the increase, or the growth shows the confidence that patient has towards Malaysia when we see the numbers increasing year by year. But of course, we understand during the pandemic in the year 2020 and year 2021, we have experienced more than 50% drop in terms of the number of travelers coming into Malaysia. But fortunately, we are looking forward to rebound when we have announced the opening of border in April. We have seen some significant increase in terms of numbers. Alhamdulillah, from March to April to May, we have seen some the numbers of patients coming into Malaysia doubling, especially to a destination like Penang and Kuala Lumpur. Right. Well, it's a very important question. I always like to measure the success of MHTC or the Malaysia healthcare as a whole, together with our private hospital, is the trust that we have from our patients and potential patients from abroad. As I mentioned just now, the indicator is always to see the numbers of patients coming into Malaysia or the revenue generated from this particular sector, give us a sense of confidence, a sense of relief that patients are confident enough to come to Malaysia in increasing numbers. So that is one or a major factor of success or indicator of success for us. But beyond that, that I can share with the viewers, Malaysia healthcare as a destination, we have been awarded with numerous awards by international organizations such as International Medical Travel Journal, IMTJ. So they have awarded Malaysia in multiple years since 2015, 16, 17 and 2020 as the destination of the year for medical tourism. So that itself is a significant testimonial that Malaysia is a true and I would say a quality destination for healthcare travellers to come to. And beyond that, MHTC ourselves have also been awarded as a cluster of the year or organization of the year for managing medical tourism coming into Malaysia. So these are some of the key awards that have been conferred to Malaysia, which is a testimonial by international organization on our industry in Malaysia. But again, when I say about success, I always would like to refer back to our patient. If they are happy here, they feel safe, and they see that Malaysia is a destination of choice, that is a big success for Malaysia already. Well, obviously, our journey since 2009 has been not an easy road. Building confidence, building our brand, building our services, quality services, working with our private hospital has always been the core principle that we want to do. But the major challenges that I would say that we have encountered so far is of course, I think it's not limited only to the medical industry. It's the pandemic of COVID-19. So it was a big challenge for us, but we were very quick to adapt. Malaysia MHTC as well as our private hospital were very quick to adapt to the current situation back then, whereby when the border were closed throughout the world, we understand that patients should be treated very, very differently. Patients should be treated specifically enough to ensure that there is a continuity of care for patients to continue to seek their treatment wherever their destination is. So for Malaysia, we felt that it was an obligation for Malaysia Healthcare Travel Council as well as our private hospital to ensure that the patient can still come in. So this is where MHTC discussed very specifically and diligently with the government to allow for a dedicated travel bubble for patients to come into Malaysia. It was granted by the government. Thank you so much for their confidence in MHTC and in our private hospital. And that happened. That happened very smoothly, where the patients were able to come even during lockdown to seek their treatment here, especially for critical treatment such as oncology, cardiology and even fertility that requires scheduled treatment. So we allow for this bubble to come, these patients to come through this bubble, and we managed to secure them to ensure the safety of Malaysian citizens and also the safety of the patient themselves. So that is a key challenge that we managed to overcome, I would say, very successfully. But beyond that, now we are moving out of the pandemic. There are other key factors that we need to look at. For example, some of the challenges is that connectivity. I believe that many airlines have started their travel sector already, but there's still not as many as pre-pandemic level. So prices of people to start to travel is still high. So that will be one of the key challenges that we need to work very closely with the airlines. And we also have some challenges in terms of how to get other countries also to join the bandwagon of opening up their borders. There are certain countries who are still under lockdown. We hope that there should be a funnel for patients to move, especially when they want to seek treatment in a different country. We have a very big target. We aspire to provide now a more seamless journey or a smooth journey for the patient from the time before they depart their destination until they finish their treatment in Malaysia, and even going for leisure traveller and move towards their country after the treatment. So we want to make sure that at every step of their journey in Malaysia is well taken care of, is easy for them to manage, and also to ensure that they have the utmost positive experience throughout their journey in Malaysia. So that is our aspiration, and we are also looking at trying to return back to the pre-pandemic level by the year of 2024 or 2025. So of course the original target is 2025, but the aspiration of MHTC and our private hospital is to bring that forward by 1 year in 2024. So how do we do this? What are the strategy that we want to look at? First and foremost, there are about 5 factors that we need to really look at. Number 1 is, when people want to start to travel again, we need to make sure that they are confident to travel. They have full trust that Malaysia is a safe destination for them to travel. So that is being managed very well between our private hospital and MHTC. So we need to make sure that this information is out there so that people feel safe when they travel to Malaysia. Number 2, we need to understand that there has been a pent-up demand. There have been so many treatment being put on hold, especially elective treatments, and then the demand will surge quite rapidly. We have seen this after our border opened in April. So the private hospital and all the healthcare institutions need to be ready in terms of infrastructure, technology, and also human resources to receive this new inflow of patients. Number 3, we understand that digitalization is the key. I'm happy that YB Minister Khairi Jamaluddin is a big proponent of digitalization, especially in healthcare. In the summit yesterday, he's been pushing for Malaysia healthcare overall to embark on a digital journey in order to provide better services, better quality services, touchless based services for our patients. So this is something that we need to work at, and all of the services providers have to look into. And number 4, if I can mention, is that we need to also look at the consumer behavior. Since we have been hit by COVID-19, there's been a change in terms of consumer behavior moving forward post-pandemic. Now we can see that there are more younger generation of patients who are more risk taker. They don't mind traveling, they don't mind going abroad to seek for treatment. They are looking for elective treatment, such as maybe dental treatment, eye treatment. They are looking for aesthetic. So these are new category of patient that we need to also provide specific attention to beyond the regular cardiology, oncology, fertility, or even pediatric. So these are things that we need to also focus on. And finally, one of the key strategy that we are also focusing on is that we need to be future-proof in terms of how we manage healthcare travelers in the future. We have learned from COVID-19. Malaysia has done it well, Alhamdulillah. We managed to have our strict dedicated bubble for patients to move forward. But in the case, in an eventuality, if there is another case in the future that there is a need for border closure again in the future, we need to understand that patients need to have a funnel for whatever country that they need to move to, not just necessarily to Malaysia. We need to treat patients dedicatedly to allow them to move from one destination to another to seek their treatment, because it is a matter of life, it is a matter of healthcare, it is a matter of well-being of the patient. So you need to be given a priority. So at that level, Malaysia cannot work alone. We have to work with partner countries around the world to ensure whenever there is an eventuality of a border closure in the future, we are ready to provide this bubble across these destinations. So these are some of the key strategies that we are looking at. Okay, I've been the CEO for a little bit more than a year. I have big aspiration, big plans. We are looking forward to put Malaysia out there as a key provider of healthcare services for the global community. We want ourselves to be positioned as a destination that provide an opportunity for people. For me, if people don't know Malaysia, if they don't know the services that we provide, if they don't know the quality that we can guarantee that for them, that when they come to Malaysia, it's a missed opportunity for them, because they may go to other destinations that cost higher or provide a more inferior quality. So I want people to know about Malaysia as much as possible when it comes to healthcare treatment. So that's number one. So how do we do it? So in order to move forward, we have launched our medical healthcare travel blueprint 2021-2025. This healthcare blueprint entails some key strategies that we want to move forward. It is a document by the industry, developed with Malaysia Healthcare Travel Council, and we want to carry this document forward very specifically. So what we are looking at, we have three specific pillars. Number one, we want to further enhance the domestic ecosystem to provide that seamless journey for the patient. We are looking at digitalization in terms of each of the touch point when the patient comes into Malaysia. Where can we facilitate further through digitalization process? For example, telehealth, telemedicine, online payment. We want to see some patient from China that can use Alipay or WeChat Pay. It will be easier for them rather than bringing in cash. We are looking at wearable apps that can also monitor their health and well-being. So we are looking at digitalization along the path of their journey in Malaysia on how to provide this solution in order for them to feel more ease to seek the treatment in Malaysia. That's number one. Number two, we are looking at enhancing the brand of Malaysia Healthcare. This is where I was saying that we want to advocate Malaysia Healthcare brand seamlessly throughout the world so that people will not miss the opportunity to seek the treatment in Malaysia, where we provide high quality services, affordability in terms of treatment, and also accessibility whereby they can get their treatment almost immediately when they come to Malaysia. And finally, the third pillar, we are looking at where can we expand our offering beyond our traditional market. So we are looking at our patients mostly from Indonesia, from Indochina, from China within this region. But I strongly believe that working very closely with our private hospital, who have been very tremendous in terms of providing the services, we can expand the healthcare services in new destinations. For example, Middle East, for example, in East Asia, Northeast Asia. These are new destinations which I believe there are still a lot more opportunity for them to understand about Malaysia healthcare. And finally, if I can just add, Malaysia is a destination of many reasons for people to come. It is not just entirely for Malaysia healthcare or entirely for healthcare treatment. When they come here, we are rich with natural resources in terms of ecotourism. We are rich with beautiful islands. We are rich with culture, food. When they come here, while seeking their treatment, they can also enjoy the beautiful part of Malaysia as a destination for tourism as well.